I saw this picture online, and the person that posted it was asking what could it be. Maybe it happened to them, or maybe they saw it on somebody else and they were asking what could it be. So I decided to use it to teach everybody about herpes, because that is very likely. Medically speaking, when we see things like that, it can be described as blisters and sores in a cluster around the mouth. So when you see that, we immediately think herpes. HSV. Herpes is a viral infection that can happen in the mouth and also in your genitals. What most people don't know is that there are two types of herpes. HSV1, which infects the mouth area, and HSV2, which infects the genitals, both male, female, the genitals, the anus, that area. Okay, so this HSV1 doesn't really mean the person is immoral or anything. It just means they had an exposure, because it can happen by sharing cups, kissing. I mean, it can easily be transmitted through contact, mouth to skin, skin to skin contact can make somebody to have herpes. And usually when you have it, it doesn't always present as the blisters that you see. That happens when there's a breakout. And the blisters usually will start with tingling, and they will go into blister, it will go into sore, and eventually will go into a crust, and eventually will heal. So it's more like a nuisance than anything else, and there's no cure. When that happens, it's something the person have to deal with for the rest of their life. The virus lives in the body, and sometimes it shades. So even when the skin looks intact, the person can still have the virus, and they can still transfer the virus. Like I said, the HSV1 usually in the mouth, the HSV2 usually in the genitals. But lately, we're beginning to see a crossover due to habits, okay? Due to licking plates, intimacy habits. You can begin to see the HSV1 in the genital area, and then the HSV2 in the mouth area. This is something that have gotten more common in recent times. So before I continue, I want to mention that you can't really make these diagnoses from a photo online. Though that picture kind of, implies herpes, but it can also be other things. It can be bacterial infection, it can be severe allergy. So for someone to have a proper diagnosis, you have to see a medical professional, and then there are other tests that can be run. So, but that being said, is also a big likelihood that could be herpes, because that's how it presents. And about 60% of adults have oral herpes, HSV1, and most of them don't even know it, because like I said, depending on people that don't even have breakouts, they carry the virus, and there are people that have breakouts frequently. It just depends on you, your immune system, yourself, and people differ. Okay, that is the bad thing about these viruses, just like HIV. Somebody can have it and they don't get very sick, and they give it to somebody else, and that person gets really, really sick. But the big difference between this and HIV is that this one is not as deadly as HIV. HIV attacks your immune cells and all that, but this one is just a nuisance. It have this breakout and it hurts, and it can affect your quality of life, because it can stop you. Like if you have those breakout like that, it may hurt you to eat. It may keep you from going outside or attending functions, because it can be embarrassing. And once you know what it is, most people may immediately generally think that is herpes, and they're thinking about genital herpes, not knowing that it's oral herpes, okay? So it's something that, if possible, you have to avoid it. That's why it's not good to go about kissing people, go about sharing, sharing spoons, sharing cups, sharing anything that will make you to transfer fluid. Is something that you should be careful about. And when you're having a partner, lately things are not like it used to be. It's very important to be careful nowadays. If you're going to be with somebody, it's always good to do all these tests to make sure what the person have and what they don't. And of course, there's a medicine for it. There is a medicine to manage it. You cannot cure it completely, but there is treatment that one can be given, and some people can stay on the treatment and it will keep the viral load down. They will not transfer it to somebody else, and it also keeps them from having breakouts. So depending on what your doctor wants or what your doctor suggests, that is what will be the best thing for you. There is no one treatment. Your doctor can decide to put you on medication, and your doctor can decide to, do lifestyle changes to help cut down the breakouts, and that will also be okay. Like I said, the virus can be present even when the skin is intact, but especially when there is micro cuts in the skin or the skin is thin, it can easily be spread. But even when the skin looks intact, the virus can still be spread. There's something called shedding, when they just shed even when the skin is intact. So if you're trying to get intimate with somebody and you see something like that, it's a good idea to pause and let it heal completely. If possible, don't be intimate till both of you get tested. But most especially if you see something, it's good to pause, let it heal completely before you become intimate with somebody. At least that will reduce the chance of them getting it, because when there's an active sore, an active blister, that means it will easily be transferred. I hope this explains it a little bit. So let's be mindful out there, because a lot of things are happening. Don't forget to like, share, subscribe if you haven't already. And until next time, leave your comments down below, and may God bless you. Bye.